Mr. Speaker, I rise to show my support for this legislation. I have no questions on the bill for the proponent, but specific to Section 1 especially, Mr. Speaker, I'm really glad that we are studying a pilot program or to figure out a way to ease the burden from a benefits cliff. I'm really proud that Connecticut has a strong safety net, and that when individuals are down on their luck, families struggling, maybe lost a job, maybe are sick, there is assistance that our state provides, whether it's through food, housing, health care. I think that's one of the things that makes our state and across the nation so great, that we don't, we work hard to try to not make people suffer. And these programs, let me say, are usually not enough. They're not providing enough resources that people need. The eligibility levels sometimes are so low. Your income has to be so low to qualify for these programs. So they're not enough, but I'm proud we've come as far as we have, and I think we can even improve it. But I talked to a group of healthcare workers, Mr. Speaker, last year. Zoom call. There was about 10 healthcare workers, worked in homes, assisting people, and these were individuals making barely minimum, minimum wage, barely above. And some of them, because of their household status, being married, having children, they qualified for some of our state assistance programs. But what they told me, Mr. Speaker, is just by working a couple extra hours of overtime each week, or getting a couple extra $1 pay raise that particular year, at the end of the year, their salary has increased. They sometimes no longer qualify for some of these programs. So imagine going from making our minimum wage $15 an hour, now all of a sudden maybe you make $19 an hour, and because of your household status, you have a couple kids, and all of a sudden now you don't qualify for health care. Just a few extra dollars an hour that you make, you all of a sudden do not have health care for yourself and maybe for your family. And that is a disaster for them. Individuals are in a very difficult situation when that happens. So there's no real, it's a disincentive to try to climb up the career ladder, to work harder, to work more hours, to make more money if you're gonna fall off this cliff. So I'm really glad we're gonna study, we're gonna try to come up with a pilot program, we're gonna try to assist people who wanna climb up that career ladder. And then also, we know with inflation, individuals may be receiving a cost of living adjustment or something like that, and just to easily fall off the cliff, I hope we will study how we can adjust the eligibility levels, whether it is an automatic increase, a cost of living adjustment, indexing to inflation, a way so people don't automatically fall off, something else we have to look at. So, Mr. Speaker, I rise in support of this bill. I hope that through this study, through a potential pilot program, we will be able then to come back here and adopt policies that provide a good fix to the benefits cliff. Thank you, Mr. Speaker.
Thank you, Representative.